The problem of chronic wounds is surprisingly large. In the United States today, there's about 6.5 to 7 million people with chronic wounds. I think it's fair to say that diabetic wounds and venous stasis wounds occupy the largest percentage of patients that we see, but those aren't all the wounds that we see. We also see patients with arterial wounds on their lower extremities. We see patients with pressure wounds. Those are usually patients who are either bed-bound or wheelchair-bound. We also see a variety of burns, and of course we see surgical wounds and traumatic wounds that for whatever reason are not healing properly. The first thing that we try to do here in the center is we try to answer the question is, what caused the wound? In other words, what type of wound is it? And secondly, why is the wound not behaving the way it was expected? So to that end, we can do a fairly thorough metabolic assessment, also a nutrition assessment. We do vascular assessments on these patients, which can involve non-invasive ultrasound, or we can also do transcutaneous oxygen monitoring here in the clinic, which gives us sort of a good map of what kind of arterial blood flow the patients have in the vicinity of the wound. So these techniques and others we can use to try to develop a plan that is specifically tailored for that particular wound in that particular patient. Chronic wound care is very much a multi-specialty discipline. And what I mean by that is that we rely heavily on our colleagues in vascular surgery, general surgery, orthopedic surgery, endocrinology, infectious disease, and the primary care specialties to help us to reach a good outcome. So it's very much a team sport. By far and away, the biggest tool that we have is what's sitting right behind me, and that's the hyperbaric chamber. The air that we breathe has about 21% oxygen. When we put patients in the chamber, they're breathing oxygen at about 10 times that concentration. And that hyperoxygenation under pressure has a variety of beneficial effects on wounds. We want patients to realize that they can self-refer to our center. If they have a wound that they're concerned about, they can certainly call us, and we're happy to see those wounds.